Hey there, welcome back to the Energy MD podcast, where we help you resolve your chronic fatigue and long COVID symptoms naturally so that you can get back to living your best life. So today I'd like to talk about EBOO, EBOO, which stands for Extracorporeal Blood Oxygenation and Ozonation, because I've been having a couple of questions from people in our community, and I wanted to share my experience and my knowledge around it. So you may have heard about this from other people who are getting the therapy. It is an oxygenative and ozonated therapy. So it is a pro-oxidant. So it does kill infections. And it can boost mitochondrial function. So this is relatively similar to major autohemotherapy with ozone. So basically, you're taking your blood, you're injecting it with ozone and oxygen, and you're putting it back into the body. And it can have a number of different benefits. It can increase mitochondrial function, which has been depressed and dysfunctional when you have chronic fatigue, since the mitochondria is found in every cell in the body except for red blood cells, and makes about 70 to 90% of all of your energy. It can also be an anti-inflammatory. It can kill infections. It can remove heavy metals. So what's the problem? Unfortunately, I've seen a number of people have die-off or a Herxheimer reaction from EBOO. So what this is that when you're killing infections, they can release their toxins into the body. And if you haven't done the proper pre-work for opening up the pathways that are getting the toxins out and infections out, then you can feel worse. And sometimes feeling worse is being down for a day, and sometimes feeling worse is being down for a month or longer. And it can set you back several weeks to months if you don't know what's happening. If you just think that it's a normal part of your illness, because when you have chronic fatigue syndrome and or long COVID, your health is in cycles, your symptoms are in cycles, where some days you're feeling better than other days. And so consequently, you may just be thinking that that's the case because the practitioner that you're seeing who is selling you the EBOO is saying that it's a wonderful therapy. And it may be, but it's best really used at the end of therapy as a cleanup rather than in the middle of therapy. And this is because, so this let's kind of go into, so in if we're talking about the pros are it can boost your mitochondria, it can act as an anti-inflammatory, it can kill infections, it can remove heavy metals. But the cons, which I've seen in a lot of folks, is that sometimes you're fine when you go in and you have the session, and sometimes you'll have die off afterwards, and so you can feel worse, kind of like I talked about. There's also the expense. It generally costs between $1,000 and $2,000, which is a really significant expense, and that's per session. And then you're going to book a session, 3 to 6 sessions. That's essentially the cost of my program over the course of a year, where we pretty much guarantee the removal of your symptoms over that period of time. So I think the hope is with EBOO is that you're going to get rid of things faster, but the reality is that another con is that it's an indiscriminate antimicrobial. So what I have seen with both this therapy and also high dose IV vitamin C and also IV ozone, which are all pro-oxidant therapies, is that they're indiscriminate antimicrobials, which means they're going to kill a lot of different infections, which means that if you haven't done the step 3 support, kind of like we talk about in our program, we're opening up the exit pathways, you have the potential of having die-off, and not just regular die-off. We increase people by a drop every couple of days in order to um, make sure that we can manage die-off appropriately. This is more like sledgehammer die-off, where you can feel really badly very quickly, and it can put you back, like I said, weeks to months. So that is the major downside that I see, besides the cost. So I think that it can be helpful, but I don't recommend it for people who have long COVID and chronic fatigue syndrome until they're really at the end. And it's kind of like, okay, we feel like we've done everything that we know to do. We've addressed 99% of your causes. Now let's see whether or not this would be especially helpful for kind of cleaning things up and seeing if there's anything less that potentially we haven't addressed. Okay, but the die-off can be so significant and can put people back and really compromises the quality of their life that this is the major reason why I don't recommend EBOO when you are going through this process. And then another con is that it's not a complete therapy. So a lot of people are looking for, the one-shot approach where you take this and it's going to fix all your problems. But I feel like it's good at killing infections, but not killing all infections. And then it can remove some heavy metals, but it doesn't remove all heavy metals and chemicals and molds. So it's missing things. And so it's a partial treatment. So the question is, do you want to spend thousands of dollars on a partial treatment that can make you feel worse, or do you want a more controlled approach? So in our program, what I found to be successful is that we have a four-step process that we take people through. The first step is to figure out what causes you have and to make sure we're addressing all of those. We're looking at over 30 different causes to make sure that we leave no stone unturned, make sure we're addressing 99% of all the possible causes. Step two is replacing the deficiencies that you have. So these are deficiencies in hormones and vitamins and minerals, etc., lifestyle habits, mindset, mitochondria. And then step three, we're opening up the detox pathways, the liver, the kidney, the lymph, the neurolymph, the gallbladder, the intestines, all these pathways that need to be open in order for you to be most successful when you get into step four and you start removing what I call the toxic five, which are the heavy metals, the chemicals, the molds, the infections, and the nervous system dysfunction. We also get rid of or address structural issues and then microclots, etc. But the big thing really is removing the toxic five. And the reason why we do this is because I have never met anybody who had chronic fatigue syndrome, or long COVID, addressed the toxic five and did not get significantly better. It's really just a matter of time when you're using treatments that work and you're addressing all of the causes. That's really the recipe for success. And so we're using a lot of tinctures to make it easy on you, where you can put them all in one glass and you can take them twice a day. And we ramp up by one drop at a time, and you document this in a spreadsheet so that we know when you start to feel worse, you reach out, you get help from us, we help you pivot, increase your step three support so that you can continue to make progress. So you're detoxifying at a rate that your body can tolerate, which is so important because then it allows you to continue to live your life, allows you to work, be with family, do whatever you need to do so that you don't end up in bed for months on end. That is, I think, one of the biggest concerns that people have when they are going through a process like this. And so we want to detoxify at a rate that the body can tolerate, and we want to take a baby step every single day because the reality is that you're going to get to the finish line. It's a marathon, not a sprint. And when you try to sprint through this, in my experience, negative things can happen, like when you're using EBOO, ozone, high dose vitamin C, etc. So hopefully that's helpful for you. If you want to resolve your symptoms, just make sure you're addressing all the causes and you're getting rid of all of them at a rate that your body can tolerate. Okay, slow and steady wins the race. And then at the end, if you want to utilize EBOO or some of these other therapies to make sure that everything is gone, you can go ahead and do that. At that point, 12 months into our program or so, once you've removed the toxic five, people are generally at a level of 8 or 9 or 10 out of 10. And the question is just when to stop treatment. And so that's when we have people do testing. We don't have people do testing initially because testing is incredibly imperfect when you first start treatment. But at the end, we can do some testing to see what do you have left in your body, if anything. And one of the things that you might want to do is do EBOO at that point in time to help clean up whatever might be present. So I hope that was helpful for you. If you have any questions, please drop them below this video and I'm happy to answer them. If this video was helpful for you, please give it a thumbs up and subscribe so you don't miss any of these moving forward. If you know somebody who's struggling with long COVID and or chronic fatigue or chronic fatigue syndrome, please share this with them. It just might help them. And if you're interested in seeing if we're a good fit to work together, you can click on the link below, learn more about what we offer, my philosophy of care, and we can get on a free call where I go through a process of seeing whether I can help you. About a third of the people that I get in calls with, I tell them that I don't think that we're a good fit to work together for whatever reason, so it's not a foregone conclusion. But if you haven't addressed your toxic five, and if you are somebody who's going to implement, then we should really get on a call together and see if we can help you. Okay, because as far as I know, this is the only life we've got. and we want to make the most out of it, and not just for ourselves, but for our loved ones, right? For our children, for our partners, for our parents, etc. We want to make sure that we're making the most of this life that we're given. So I hope this was helpful. I'll see you in the next episode or on one of these free calls. Have an amazing day. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening and have an amazing day.